Thanks. We found that quite difficult. We tried to take an evidence-based approach, but then Anna Dixon pointed out that there was absolutely no evidence in this area about what sorts of regulation were effective and how the message ought to be delivered. So what you have really is a consensus view. We thought that the shape of the message really would be tied up with other things that have been discussed about the role and the powers of the regulator. So we couldn't be entirely precise about that without knowing what regulatory system would be in place. But we thought it was important to define the message in terms of the effect you wanted from it. So if the message was going to be part of enforcement, then it needed to be a fairly strong message, a fairly public message, what I think one member referred to as the Daily Mail option. The other way the message could be delivered, of course, is in a much more collaborative and formative way, which I think we would prefer. There was a useful point made about the volume of messages that trusts would be receiving from a variety of regulators, accreditators, peer reviewers, working groups, etc. And that for the benefits of the average foundation trust, there needed to be some prioritization and coordination of this message stream. We thought it was important that the messages were diffused at every level within the organisation, and that the most junior staff should be aware of what the Trust was achieving, not achieving, and how they might help to improve matters. The other important characteristic of the message would depend on how the regulator saw itself in terms of its role, either as simply describing a problem or trying to help with quality improvement. And the message might or might not, therefore, include a direction about how problems could be corrected. We talked a little bit about excellence. So patients might be interested in messages about excellence, not just achievement of minimum standards. And perhaps that's where service accreditation comes in, and particularly in a market-based competitive environment, organisations might well want messages about their maximum achievements, not their minimum achievements, broadcast. We ended up by talking about the importance of internal messages, internal regulation, what I think Peter Homer referred to very powerfully in his presentation about the need for these messages to be generated and acted upon from within. And that has a lot to do with professionalism. It's got a lot to do whether the organisation listens to those messages coming up from the ground floor. And we finished up by thinking about an imaginary conversation between a professional saying we have not got enough nurses and a medical director saying we have not got enough money. But we couldn't take it any further than that in the time allowed.
Very good. Just one thing that Nick Hardwick mentioned at the end of his inspections, they share those messages from the prison inspection then and there. Does that sound to you as if a good idea as opposed to waiting several months or longer for a report?
On that point, we had a bit of discussion, and we have a model for doing that. The Mental Health Act Commission visits have been exactly like that. You sit down at the end of the day in front of a whole range of staff, get feedback, involves meeting patients and getting it. So, I mean, we have got that in the health sector to learn from.
That's great. Thank you very much. And last but not least, before our tea break, we did ask our two tables at the back general comments on what they've heard. So any points you'd like to add?
Yeah. I just think the issue with regulation is that there's no desire for the government to have an effective regulator, because basically if there is an effective regulator, then everybody will know what's actually going on in regards to the NHS, in my opinion. So I personally don't think that there is a desire for the government to have an effective regulator.
Surely it's not in their interest to have a regulator that doesn't work and that...
Yeah, of course it is, because the truth gets hidden. I might be sceptical, but that, in my opinion, it's not that difficult to regulate this industry. So why isn't it effectively regulated?
I thought we'd probably frame our feedback based on a number of quotes from some of the talks this morning. The first one, which sort of framed our discussion around high and low trust, whether or not we treat the NHS and healthcare as a high or a low trust system. And the quote that came from this morning was that without public trust, we have no future. And we had quite a lengthy discussion about the fact that we seem to be unable even to do the basics reliably at the moment, and that really that was what people out there wanted to see was an ability for the system to be able to do the basics reliably. We talked then quite a lot about the learning of lessons and how that happened. And again, drawing on some of the discussions this morning, it seemed that the healthcare system has not got a great track record when it comes to learning lessons. It talks a lot about the importance of learning lessons, but there's very little evidence, even from major inquiries, Bristol, Shipman, and dare I say it, you know, where is this learning going to take us?
Lots of consistency.
And therefore, the question was, do we need to be thinking about some alternative ways of learning lessons? And we talked on the table about the importance of stories, of hearing both professional and patient stories, and how powerful those can be in terms of helping to learn lessons, and to connect with the sort of moral and ethical issues that we feel are very significant. And the other issue we talked about was the need for independent investigation, and that at the moment the system has woefully inadequate skills when it comes to forensic investigation, and that needs to be happening on an independent basis, on a much more regular basis, so where there are serious adverse incidents, independent investigation is needed. We also talked quite a lot about a new conversation around professionalism, and the need for discussions about what is acceptable. And this links with the idea that actually the first line of regulation has got to be in that basic interaction between professional and patient. But if we don't have good understandings of what is acceptable professional practice and what constitutes harm in the system, then we have a problem. And that consequently possibly more challenge is needed around that. And the final point was the quote that I think came from Andrew this morning, which was, "Do not blame the regulator for your own failures. I cannot and will not expect the regulator to do my job for me." And I think that really encapsulates, again, that sense of we cannot accept having a position where we are looking to a regulator to be dealing with issues that have to be dealt with at a very intimate and individual level in patient interactions.
That's fantastic. Thank you.